Hello, my name is Patricia Basualto, PhD candidate at the University of Calgary. In British Columbia, families of children and youth with support needs still face a narrow door to access services. Our interviews with providers and decision makers suggest how to widen it. Too often, families of children and youth with support needs in Canada are forced to navigate a confusing and fragmented system to access the support they need. Despite Canada's commitments under the United Nations Conventions on the Rights of Persons with Disabilities, children and youth with support needs and their families face barriers in accessing basic services that are critical for their inclusion, development, and well-being. Families describe overwhelming processes, long wait times, and inconsistent eligibility criteria across regions. While we know that personal and contextual factors affect who gets access, we lack system-level data to guide fair, coordinated, and effective solutions. This research aims to address that gap by exploring ways to improve access to disability services for children and youth with support needs through a lens of equity, rights, and lived experience. Using a qualitative descriptive methodology, we explore the perspective of 16 decision-makers and frontline professionals in the British Columbia Disability Services System. We aimed to identify barriers and facilitators affecting equitable access to health, education, and disability support for children and youth ages 0 to 18 with support needs. Through this system-level lens, the study sought to generate actionable recommendations for policy and service reform. The interviewees represented a wealth of long-term experience working in the British Columbia Disability Service System, serving urban, rural, reserve, and settlement communities across the system. 6 barriers and facilitators could be identified along the navigation process of disability services and support, which can be summarized in 3 main groups: collaboration and trust, families with early and timely insider knowledge get further, siloed and rigid system. Even though cross-ministry protocols are documented, they often don't reach frontline workers. Also, they tend to limit the system adaptation capacity. And finally, the strict eligibility criteria, the diminished system capacity, and wait list contribute to leaving the children's needs unmet. So, what can be done next? Participants recommended 6 changes aimed at creating a wider door in policy and a holistic system that works for everybody. This can be organized as shift from diagnosis-based eligibility criteria to a criteria based on functional needs. Tie cross-ministry protocols to action frontline workflows and shared tools within and across sectors. Build rural remote flexibility across jurisdictions through virtual, mobile, and outreach models. Fund community-based navigators supported with cultural safety training. Thank you to all of you for connecting to this presentation, and a big thank you to our supporters.